The notification chimed on my computer at exactly 11:47 p.m., and everything I thought I knew about my marriage and my husband's medical practice shattered in that single moment. Dr. Marcus Sterling thought he was so clever believing his partnership agreement protected him from consequences while he systematically defrauded patients and insurance companies. What my brilliant cardiac surgeon husband didn't realize was that Article 15, buried deep in our medical partnership contract, contained ethics violation penalty clauses that would cost him everything he valued most. I'm Dr. Sophia Chen, Chief Medical Fraud Investigator at Stanford Medical Center, and this is how I used my husband's own legal weapon against him when I discovered his criminal enterprise disguised as life-saving surgery. The irony wasn't lost on me that Marcus Sterling, one of Palo Alto's most respected cardiac surgeons, had drafted what he thought was an ironclad partnership agreement to protect his medical practice from potential complications. What he hadn't counted on was marrying a forensic medical examiner turned fraud investigator who actually read every single clause, especially the ones he thought were standard legal jargon that would never be enforced. That late Thursday night, as autumn rain pelted our glass-walled home in Palo Alto Hills, I sat in my home office reviewing quarterly insurance fraud reports when Stanford's automated audit system flagged suspicious billing patterns. The algorithm had been designed to catch medical fraud across our network, but I never expected it to identify irregularities in my own husband's cardiovascular practice. My hands remained steady as I opened the detailed analysis, entering my security credentials with the same precision I used for forensic medical examinations. 4 years of marriage had taught me Marcus's patterns, his habits, his overconfident approach to documentation that would ultimately be his downfall. The audit revealed systematic billing irregularities at Sterling Cardiovascular Institute. Phantom surgeries billed to insurance while patients were actually treated by residents' inflated procedure codes for unnecessary interventions and consultation fees for meetings that never occurred. What struck me most wasn't the fraud itself. I'd seen similar schemes throughout my career, but Marcus's casual arrogance in believing his reputation made him untouchable. The water stopped running upstairs, and I heard Marcus's familiar footsteps crossing our bedroom floor. I closed the audit report, saved the files to an encrypted drive, and walked calmly to my office safe where I kept our important documents, including the partnership agreement Marcus had presented to me 6 months before our wedding. He'd insisted it was standard practice for someone in his position protecting the medical practice and research investments he'd accumulated before our relationship. I'd agreed readily, even enthusiastically, because I believed in protecting individual professional assets within marriage. Now, as I spread the contract across my mahogany desk under the warm glow of my banker's lamp, I wasn't looking at it as Marcus's trusting wife. I was examining it with the sharp eye of someone who'd spent a decade investigating medical fraud for hidden risks and criminal violations. The notification that had started this discovery would prove to be just the beginning of the most complex medical fraud case in California history. Dr. Sophia Chen had always been methodical by nature. While other children played doctor with toy stethoscopes, she was dissecting frogs in her garage laboratory, fascinated by the precision required to understand how biological systems functioned or failed. My career as Chief Medical Fraud Investigator at Stanford Medical Center had been built on pattern recognition, forensic analysis, and an almost supernatural ability to detect when medical professionals were lying about their practices. The transition from forensic pathologist to fraud investigator had been inevitable. After 5 years performing autopsies and determining causes of death, I'd become increasingly frustrated by cases where medical malpractice or fraud had contributed to preventable deaths. When Stanford offered me the opportunity to head their newly created medical fraud investigation unit, I'd seized the chance to prevent harm, rather than simply documenting it after the fact. Dr. Marcus Sterling represented everything I'd once admired in the medical profession. At 38, he was a renowned cardiac surgeon whose innovative, minimally invasive techniques had saved hundreds of lives throughout Northern California. His Sterling Cardiovascular Institute occupied an entire floor of the prestigious Palo Alto Medical Plaza, equipped with state-of-the-art surgical suites and research facilities that attracted patients from across the globe. We'd met 4 years ago during a medical conference in San Francisco, where Marcus was presenting breakthrough research on robotic cardiac surgery, while I was delivering a keynote on preventing medical fraud in research settings. The irony of that meeting would become painfully obvious much later. Marcus had approached me after my presentation, claiming professional interest in my fraud detection methodologies, though his attention had quickly shifted from professional to personal. Our courtship had been a whirlwind of medical conferences, research collaborations, and shared dinners where we discussed the ethical challenges facing modern medicine. Marcus's passion for saving lives through innovative surgery had seemed perfectly aligned with my commitment to protecting patients through fraud prevention. He'd been the ideal partner, brilliant, successful, and apparently dedicated to the highest standards of medical ethics. The partnership agreement Marcus had proposed 6 months before our wedding had seemed like a natural evolution of our professional respect for each other. Unlike a traditional prenuptial agreement focused on personal assets, our contract specifically addressed the protection of medical practices, research, intellectual property, and professional licensing rights. Marcus had explained that cardiac surgery partnerships required sophisticated legal structures to protect against malpractice liability while ensuring that individual practitioners maintained control over their specialized practices. I'd reviewed the 52-page document with the same thoroughness I applied to forensic medical reports, noting the complex clauses addressing everything from patient database ownership to medical equipment depreciation schedules. The partnership agreement's emphasis on ethical compliance and professional standards maintenance had actually impressed me, suggesting that Marcus understood the critical importance of maintaining medical integrity in an era of increasing healthcare fraud. Our marriage had settled into a comfortable rhythm of professional success and domestic harmony. Marcus typically left for the hospital by 6:30 a.m. for pre-surgical consultations, spent his days performing complex cardiac procedures, and returned home by 8 p.m. for dinner and case review. I maintained similar hours at Stanford, investigating medical fraud cases that ranged from simple billing irregularities to complex research misconduct involving millions of dollars in federal funding. Our Palo Alto Hills home reflected our combined success, a 500 square foot modernist structure with floor-to-ceiling windows overlooking Silicon Valley, equipped with dual home offices, where we could work independently while remaining connected to our respective medical institutions. The house had been featured in Architectural Digest as an example of how medical professionals could create spaces that balanced clinical precision with personal warmth. Marcus's home office occupied the corner suite with panoramic views of the San Francisco Bay, filled with medical journals, surgical awards, and expensive art that impressed the pharmaceutical executives and medical device representatives who frequently visited for private consultations. My office, smaller but equally sophisticated, contained the specialized computer systems and secure storage facilities required for handling sensitive medical fraud investigation materials. The basement had been converted into Marcus's private research laboratory, where he claimed to develop new surgical techniques and test innovative medical devices. His late-night work sessions in the lab had become increasingly frequent over the past year, though. He explained this as preparation for presenting breakthrough research at upcoming medical conferences. Our social life revolved around the elite medical community of Silicon Valley, attending hospital fundraising galas, where Marcus was frequently honored for his surgical innovations while I received recognition for my fraud prevention work. We were the power couple of Palo Alto medicine, the brilliant surgeon saving lives through innovative procedures, and the dedicated investigator protecting patients from medical exploitation. Marcus's colleagues at Sterling Cardiovascular Institute included some of the most respected cardiac surgeons on the West Coast, along with the support staff of anesthesiologists, surgical nurses, and medical residents who rotated through the practice as part of their advanced training. The practice's reputation for excellence had attracted partnerships with major medical device companies and pharmaceutical firms conducting clinical trials for next-generation cardiac treatments. The financial success of Sterling Cardiovascular Institute had allowed Marcus to accumulate substantial assets independently of our marriage real estate investments throughout California, a portfolio of medical technology stocks and ownership stakes in several biotech startup companies developing cardiac devices. The partnership agreement had been designed to protect these investments while ensuring that our marriage remained financially equitable despite our different earning potentials. My own career had been equally successful, though my government salary at Stanford was modest compared to Marcus's private practice income. My expertise in medical fraud investigation had led to consulting opportunities with federal agencies, insurance companies, and law firms handling medical malpractice cases. These consulting fees, combined with speaking engagements and expert witness testimony, had provided me with financial independence that complemented Marcus's surgical practice success. The partnership agreement had seemed like the perfect legal framework for two medical professionals who understood the importance of protecting individual achievements while building a shared life together. Neither of us had anticipated that the document would eventually become the instrument of Marcus's complete professional and personal destruction. The Stanford Medical Center's fraud detection algorithm had been my innovation designed to identify billing irregularities and treatment patterns that suggested potential misconduct by medical providers throughout our network. The system analyzed millions of insurance claims, patient records, and procedural codes to detect anomalies that human investigators might miss due to the sheer volume of data involved. Thursday night's automated audit had flagged Sterling Cardiovascular Institute for multiple red flags: an unusually high ratio of complex procedures relative to patient diagnoses, billing codes that didn't match documented surgical times, and consultation fees charged for dates when the primary surgeon was documented as being in different locations. The algorithm's confidence level was 94% higher than most cases that resulted in successful fraud prosecutions. My initial review of the flagged data revealed patterns that immediately concerned me as both a fraud investigator and Marcus's wife. The billing irregularities weren't random errors or occasional oversights. They represented systematic manipulation of medical codes designed to maximize insurance reimbursements while minimizing the actual medical services provided to patients. The most disturbing discovery came from cross-referencing surgical suite booking records with actual procedure billings. Marcus had been billing insurance companies for performing complex cardiac surgeries during time periods when hospital security records showed he was either not present in the building or was documented as being in different areas of the medical complex. These phantom surgeries represented hundreds of thousands of dollars in fraudulent billing over the past 18 months. Patient records revealed an even more troubling pattern. Marcus had been delegating increasingly complex surgical procedures to cardiac surgery residents while billing the operations as if he had personally performed them. Insurance companies were paying premium rates for procedures performed by doctors still in training, creating both financial fraud and serious patient safety concerns. The consultation billing irregularities led me to examine Marcus's appointment schedules in detail. His calendar showed frequent patient consultations with Dr. Natasha Volkov, a 29-year-old anesthesiologist who had joined Sterling Cardiovascular Institute 8 months ago. These consultations were consistently billed to insurance companies as legitimate medical meetings, but the frequency and timing suggested something other than professional collaboration. Dr. Volkov's employment file, accessible through Stanford's medical staff database, painted a picture of a talented but inexperienced anesthesiologist who had been promoted rapidly since joining Marcus's practice. Her salary had increased by 85% in 8 months, along with bonuses and professional development opportunities that other anesthesiologists in the practice hadn't received. This preferential treatment suggested a relationship that extended beyond professional mentorship. Hospital security records provided the digital trail that confirmed my suspicions. Marcus's keycard access logs showed frequent after-hours visits to Dr. Volkov's office, extended stays in unused surgical suites during non-operational hours, and time spent in private consultation rooms during periods when both physicians were supposedly conducting patient care. The pattern of their movements through the hospital suggested a systematic effort to conduct personal meetings while maintaining the appearance of professional activity. The financial implications of Marcus's fraud were staggering. My preliminary analysis identified over $2.3 million in questionable billing over 18 months, representing systematic theft from insurance companies and endangerment of patients who believed they were receiving care from an experienced cardiac surgeon. Each fraudulent billing represented a violation of medical ethics, insurance regulations, and federal healthcare laws that carried serious criminal penalties. Electronic medical records revealed another disturbing dimension of Marcus's misconduct: unnecessary cardiac procedures recommended to patients whose conditions could have been treated with less invasive methods. Marcus had been convincing patients to undergo expensive surgical interventions that generated maximum insurance reimbursements, while exposing them to surgical risks that weren't medically justified. These cases represented not just financial fraud, but potential medical malpractice that could have resulted in preventable deaths. The prescription drug monitoring systems showed irregularities in controlled substance dispensing at Sterling Cardiovascular Institute. Large quantities of post-surgical pain medications were being ordered for patients, but the amounts didn't correlate with the documented procedures or patient needs. This suggested potential drug diversion schemes where medications prescribed for legitimate patients were being diverted for personal use or illegal sale. Cross-referencing Marcus's travel schedule with surgical billing records revealed that he had been billing insurance companies for procedures performed while he was attending medical conferences in other states. These cases involved residents performing surgeries under the supposed supervision of attending physicians who were actually hundreds of miles away, creating serious liability issues for the hospital and insurance fraud violations for Marcus. The most shocking discovery came from examining the financial relationships between Sterling Cardiovascular Institute and medical device manufacturers. Marcus had been accepting substantial consulting fees and research grants from companies whose cardiac devices he was implanting in patients, but these financial relationships weren't being disclosed to patients as required by medical ethics regulations. This created conflicts of interest where Marcus's surgical recommendations might be influenced by personal financial gain rather than patient needs. Dr. Volkov's role in these schemes became clearer as I examined anesthesiology records for surgeries where residents had performed procedures under inadequate supervision. Her anesthesia notes contained subtle alterations that supported billing codes for more complex procedures than had actually been performed, making her an active participant in the fraud rather than simply Marcus's romantic interest. The digital forensics trail revealed sophisticated efforts to conceal these activities through careful manipulation of electronic medical records. Surgical times were adjusted to support billing codes. Patient diagnoses were enhanced to justify unnecessary procedures, and consultation notes were backdated to create false documentation for insurance reimbursement claims. This level of systematic record falsification suggested criminal intent rather than simple billing errors. Hospital pharmacy records showed another dimension of Marcus's criminal activity. Controlled substances were being dispensed for surgeries that had never occurred, or for patients who had received less medication than documented. This suggested a drug trafficking operation where prescription medications were being diverted from legitimate medical use to illegal distribution networks. The patterns I discovered extended beyond individual fraud cases to suggest systematic corruption within Sterling Cardiovascular Institute. Multiple physicians, administrative staff, and support personnel appeared to be participating in various aspects of the fraud, creating a criminal enterprise that used the prestigious medical practice as cover for illegal activities that threatened both patient safety and healthcare system integrity. As the scope of Marcus's criminal activities became clear, I realized that my discovery represented far more than a cheating husband who had violated our marriage vows. The evidence suggested a sophisticated medical fraud operation that endangered patients while stealing millions of dollars from insurance systems designed to provide healthcare security for families throughout California. The investigation had evolved from personal betrayal to professional obligation, protecting patients from a criminal who had perverted his medical training to exploit the people he had sworn to heal. The partnership agreement that Marcus had drafted so carefully to protect his medical practice assets contained the very clauses that would ensure his complete professional and financial destruction. As I spread the 52-page contract across my desk in the quiet hours after midnight, I wasn't looking at it as Marcus's trusting wife. I was examining it with the analytical precision that had made me one of the nation's leading medical fraud investigators. Article 15, titled Professional Ethics and Compliance Standards, contained language that Marcus had likely copied from a medical licensing template without fully considering its enforcement implications. The section clearly stated that any partner engaging in medical fraud, patient endangerment, or professional misconduct resulting in financial deception would forfeit their right to protected practice assets and become liable for substantial financial penalties, including legal fees, damages for patient harm, and liquidation of all medical practice investments, with proceeds going entirely to the injured party. Marcus had essentially written his own professional death sentence, and Dr. Natasha Volkov had been unknowingly helping him document every violation through their systematic manipulation of surgical billing codes and patient records. The irony was delicious and devastating. His attempts to protect his medical practice from potential marital complications had created a legal trap that would strip away everything he had worked to build. The basement archives of our home contain Marcus's professional filing system, including template contracts he'd used for other medical partnerships throughout his career. I needed to understand whether Article 15 was standard language he used for all professional agreements or something specifically crafted for our marriage partnership. Moving quietly through the house, I descended to Marcus's domain and began methodically searching his legal files. What I discovered was even more damning than I'd hoped. Marcus had used modified versions of Article 15 in dozens of medical partnership agreements he had drafted for colleagues throughout the Silicon Valley medical community, but our version contained additional clauses that made the penalties more severe and the enforcement mechanisms more comprehensive. He'd been so focused on protecting his cardiac surgery practice from me that he'd inadvertently created a legal weapon that could be used against him with devastating effectiveness. His computer password protection proved as inadequate as his understanding of the contract he'd written. The password was our wedding date, followed by his medical license number, hardly the sophisticated cybersecurity approach one would expect from a cardiovascular surgeon who claimed to understand the importance of protecting sensitive medical information. Marcus's email archives revealed the true scope of his relationship with Dr. Volkov, including detailed discussions about how the partnership agreement would protect him if I ever discovered his professional misconduct. Multiple message threads showed Marcus explaining to Natasha how medical partnership contracts were structured differently from traditional prenuptial agreements, giving him confidence that his practice assets would remain untouchable, regardless of any marital complications that might arise from their affair. These communications revealed that Natasha wasn't Marcus's first extramarital adventure, just his most recent and most systematically documented. Previous relationships had involved other medical professionals within his practice, suggesting a pattern of using his position as practice owner to exploit power dynamics with female colleagues, while believing that his legal protections made him immune from consequences. The partnership agreement contained another clause that Marcus had apparently forgotten in his enthusiasm for medical fraud. Section 12 detailed transparency requirements, mandating that both parties maintain complete financial disclosure about any activities that might affect the practice's ethical standing or professional licensing status. Marcus's secret billing fraud schemes, funded through systematic insurance deception and false medical documentation, constituted a massive breach of these transparency requirements. Section 18 proved even more devastating to Marcus's position. This clause established that any partner who engaged in criminal activities using practice resources would forfeit all claims to protected assets, while becoming personally liable for any damages resulting from their misconduct. Marcus's use of Sterling Cardiovascular Institute facilities equipment and staff to conduct systematic medical fraud created exposure that extended far beyond simple partnership dissolution. The financial calculations were staggering. Under Article 15's penalty structure, Marcus's violations could result in the forfeiture of his entire medical practice, including surgical equipment worth over $3 million real estate investments throughout California, his partnership stakes in biotech companies, and his collection of rare medical texts and surgical instruments. Additional penalties for professional deception could exceed $2 million in direct compensation, not including legal fees and court costs that Marcus would be required to pay under the contract's enforcement provisions. The protected assets Marcus thought were safe, his premarital investments in medical technology stocks, his ownership stake in the Palo Alto Medical Plaza, even his prized collection of vintage surgical instruments would become available for seizure under the contract's penalty clauses. Each violation carried specific financial consequences that he had apparently never calculated when drafting the agreement's enforcement mechanisms. Morning sunlight was filtering through my office windows as I carefully filed away all the evidence I'd gathered during my sleepless night of legal analysis. Marcus would shower dress in one of his expensive surgical scrubs and head to the hospital, where he would spend the day advising patients about cardiac procedures while living as a walking violation of every medical ethics principle he claimed to uphold. The partnership agreement he'd crafted so carefully to protect himself was about to become the foundation for the most expensive lesson in medical ethics that Silicon Valley had ever witnessed. His confidence in his legal immunity had been based on a fundamental misunderstanding of the very contract he had written, creating an ironic situation where his own legal expertise would be turned against him with devastating precision. The document that was supposed to protect Dr. Marcus Sterling from the consequences of his professional misconduct had instead created a comprehensive framework for his complete destruction. Every fraudulent billing, every insurance deception, every patient safety violation he had committed was about to become evidence in a case that would strip away his medical license, his practice assets, and his professional reputation, all through enforcement of the contract he had confidently believed would protect him from exactly these consequences. The transformation from betrayed wife to strategic prosecutor occurred in the space between discovering Marcus's crimes and deciding how to respond to them. As dawn broke over Palo Alto Hills, painting our glass-walled home in shades of gold and amber, I faced a choice that would define not only my marriage's end, but potentially save countless patients from a criminal who had perverted his medical training into an instrument of exploitation. My background in forensic medical examination had taught me that the difference between justice and revenge lay in methodology. Revenge was emotional and impulsive, while justice required systematic evidence, gathering careful planning and coordination with appropriate authorities. Marcus's medical fraud wasn't just a personal betrayal. It represented a threat to patient safety and healthcare system integrity that demanded professional intervention rather than simply personal retaliation. The partnership agreement that Marcus had trusted to protect his medical practice would become the foundation for his destruction, but only if I approached the situation with the same analytical precision I applied to complex fraud investigations. This wasn't about winning a divorce settlement or claiming community property. This was about using every legal and professional resource available to ensure that a dangerous criminal faced appropriate consequences for endangering the patients he had sworn to protect. My position as chief medical fraud investigator at Stanford Medical Center provided access to resources and expertise that most betrayed spouses couldn't leverage. I could coordinate with healthcare fraud prosecutors, insurance company investigators, medical licensing boards, and law enforcement agencies to build a comprehensive case that would prevent Marcus from simply moving his criminal operations to another jurisdiction. The evidence I had discovered during my initial investigation represented just the beginning of what would need to be a thorough, systematic prosecution of medical fraud that extended far beyond Marcus's individual crimes. Natasha Volkov's participation suggested a conspiracy that might involve other medical professionals, while the systematic nature of the billing fraud indicated criminal sophistication that could affect patients throughout the Silicon Valley medical community. The next phase would require careful coordination to prevent Marcus from destroying evidence or alerting other potential co-conspirators about the investigation. His overconfidence in the partnership agreement's protection would work in my favor, as he would likely continue his criminal activities while believing himself immune from consequences. This would provide opportunities to gather additional evidence while building relationships with law enforcement agencies that specialized in medical fraud prosecution. My phone buzzed with Marcus's morning text message asking about my plans for the day and reminding me about the medical charity gala we were scheduled to attend that weekend. His casual tone and continued domestic performance would provide cover for the investigation I was about to launch, an investigation that would transform Dr. Marcus Sterling from a respected cardiac surgeon into the central figure in the largest medical fraud prosecution in California history. The partnership agreement he had written to protect himself was about to become the instrument of justice for every patient he had betrayed through his criminal transformation of medical practice into systematic fraud. My first call Friday morning went to Dr. Jennifer Walsh, the most respected medical ethics attorney on the West Coast. Jennifer had built her practice at UC San Francisco, representing healthcare professionals in complex licensing disputes, but more importantly, she specialized in cases where medical practitioners had crossed the line from ethical violations into criminal fraud. Her reputation for thoroughness and her connections throughout California's medical regulatory system would prove invaluable for dismantling Marcus's criminal enterprise. Jennifer's office overlooks San Francisco Bay from the 32nd floor of the Embarcadero Center, a fitting location for someone who had spent 15 years navigating the treacherous waters where medical ethics intersected with criminal law. When I explained the evidence I had discovered about Marcus's systematic fraud at Sterling Cardiovascular Institute, her initial reaction was professional skepticism, until I began detailing the specific billing irregularities and patient safety violations that my investigation had uncovered. "Sophia," Jennifer said quietly after reviewing my preliminary evidence summary, "your husband didn't just violate medical ethics. He created a criminal enterprise disguised as cardiac surgery practice. We're looking at federal healthcare fraud insurance conspiracy and potential patient endangerment charges that could result in decades of imprisonment." Jennifer's analysis of our partnership agreement confirmed my own assessment while revealing additional enforcement mechanisms that I hadn't fully appreciated. The contract's emphasis on professional standards maintenance created legal obligations that extended far beyond simple marital fidelity, establishing Marcus's systematic fraud as grounds for complete asset forfeiture under civil asset seizure laws that were designed to strip criminal enterprises of their ill-gotten gains. My second critical alliance came through Jennifer's recommendation, Detective Ray Morrison from the California Department of Justice Healthcare Fraud Unit. Detective Morrison had spent 12 years investigating medical fraud cases ranging from simple billing irregularities to complex criminal conspiracies involving organized crime infiltration of legitimate medical practices. His experience with medical fraud prosecution would ensure that Marcus faced criminal charges commensurate with the scope of his violations. Detective Morrison's initial review of my evidence exceeded even Jennifer's assessment of its significance. "Dr. Chen," he explained during our secure meeting at the DOJ offices in Sacramento. What you've documented represents one of the most systematic medical fraud operations we've seen in California. The billing irregularities alone suggest federal charges, but the patient safety violations and controlled substance irregularities indicate criminal activity that threatens public health and safety. The third member of our core team was my sister, Sarah Chen, a certified fraud examiner who specialized in forensic accounting for medical practices. Sarah's expertise in healthcare financial analysis would be crucial for documenting the full scope of Marcus's fraud while ensuring that our evidence met the exacting standards required for criminal prosecution. Her previous work with federal agencies investigating Medicare fraud had taught her the sophisticated techniques that medical criminals use to disguise illegal activities within legitimate practice operations. Sarah's preliminary analysis of Sterling Cardiovascular Institute's financial records revealed criminal sophistication that surprised even experienced fraud investigators. Marcus hasn't just been stealing money, she explained during our first team meeting. He's created parallel accounting systems that allow him to track legitimate medical practice income separately from criminal proceeds, suggesting criminal planning that extends far beyond opportunistic fraud. Our initial strategy session took place in Jennifer's secure conference room, equipped with encryption technology and privacy protections that prevented electronic surveillance of our discussions. The comprehensive evidence I had assembled created multiple prosecution pathways: medical licensing violations that could strip Marcus of his professional credentials, insurance fraud charges that carried federal prison sentences, and civil asset forfeiture proceedings that would claim his practice assets as proceeds of criminal activity. Detective Morrison outlined the law enforcement resources that would be available for our investigation: federal healthcare fraud prosecutors who specialized in complex medical cases, insurance company investigators who had been tracking similar fraud patterns throughout California, and medical board enforcement agents who could coordinate professional sanctions with criminal prosecution. The multi-agency approach would ensure that Marcus faced consequences in every jurisdiction where his crimes had been committed. Jennifer's legal strategy focused on using the partnership agreement's enforcement clauses to prevent Marcus from protecting assets or destroying evidence once he realized his situation. The contract's transparency requirements created legal obligations that would make any attempt to conceal evidence a separate violation, carrying additional penalties. Marcus's own legal document would become a trap that prevented him from taking defensive measures while providing prosecutors with additional charges for any obstruction attempts. Sarah's forensic accounting plan involved comprehensive analysis of financial records spanning Marcus's entire medical career, identifying patterns that might reveal additional criminal activities or co-conspirators. Her examination would extend beyond Sterling Cardiovascular Institute to include Marcus's research partnerships, consulting relationships, and investment activities that might have been used to launder criminal proceeds through legitimate business ventures. The team also included Dr. Maria Santos, a patient safety advocate who had spent 8 years representing families harmed by medical malpractice and fraud. Dr. Santos's involvement would ensure that patient victims received appropriate compensation while providing prosecutors with compelling testimony about the human cost of Marcus's criminal activities. Her expertise in medical harm assessment would be crucial for documenting cases where Marcus's fraud had resulted in preventable injuries or deaths. Our final core team member was Ryan Park, a digital forensics specialist who had worked with federal agencies investigating cybercrime and electronic evidence manipulation. Ryan's technical expertise would be essential for recovering deleted communications, analyzing medical database alterations, and documenting the sophisticated methods Marcus had used to conceal his criminal activities through manipulation of electronic medical records. The coordination meeting concluded with a detailed timeline for evidence gathering and prosecution preparation that would prevent Marcus from destroying evidence while ensuring that all relevant criminal activities were documented before initiating formal proceedings. Each team member would focus on their area of expertise while maintaining communication protocols that protected the investigation's integrity and prevented premature disclosure that might compromise our effectiveness. Jennifer's final assessment was both sobering and encouraging. We have the evidence, expertise, and legal framework necessary to ensure that Marcus faces appropriate consequences for his crimes, The partnership agreement he trusted to protect his assets will become the instrument of his complete professional and financial destruction, while his victims finally receive the justice they deserve. The systematic documentation of Marcus's criminal activities required a level of methodical precision that transformed my home office into a command center for one of the most complex medical fraud investigations in California history. Working with Sarah's forensic accounting expertise and Ryan Park's digital forensics capabilities, we began assembling evidence that would prove Marcus's guilt beyond any reasonable doubt, while documenting every victim harmed by his systematic transformation of cardiac surgery into criminal enterprise. Sarah's analysis of Sterling Cardiovascular Institute's financial records revealed the true scope of Marcus's fraud over $4.7 million in fraudulent insurance billing, spanning 3 years, involving 847 separate cases, where patients had been billed for procedures they never received, or surgeries performed by unqualified residents, while Marcus was documented as being elsewhere. Each case represented multiple violations of federal healthcare laws, insurance regulations, and medical ethics standards that carried both criminal penalties and civil liability. The phantom surgery documentation was particularly damaging to Marcus's defense prospects. Hospital security records showed Marcus leaving the medical complex at specific times, while his surgical billing indicated he was performing complex cardiac procedures that supposedly lasted for hours. Cross-referencing these records with patient charts revealed that cardiac surgery residents had been performing operations without adequate supervision, while Marcus was attending pharmaceutical company events, medical conferences, or conducting personal activities with Dr. Natasha Volkov. Ryan's digital forensics examination of Marcus's computer systems uncovered deleted communications that revealed the systematic nature of his criminal planning. Recovered email threads showed Marcus coordinating with medical device sales representatives to recommend unnecessary cardiac procedures that would generate maximum commissions, while encrypted messaging apps contained discussions about patient selection criteria that prioritized insurance coverage over medical necessity. The most disturbing evidence came from Marcus's personal calendar and financial planning documents, which revealed that he had been calculating expected profits from unnecessary surgeries as part of his annual income projections. Patients with comprehensive insurance coverage were systematically targeted for complex procedures that generated maximum reimbursements, while their actual medical conditions could have been treated with less invasive and less expensive alternatives. Dr. Volkov's role in the conspiracy extended far beyond romantic involvement. Her anesthesiology records contained systematic alterations that supported fraudulent billing codes, while her controlled substance dispensing logs showed irregularities that suggested drug diversion schemes operating parallel to the surgical fraud. Communications recovered from her devices revealed that she had been recruited by Marcus specifically for her willingness to participate in billing fraud and her access to controlled medications. The controlled substance analysis revealed another dimension of Marcus's criminal enterprise. Prescription painkillers ordered for post-surgical patients were being diverted in quantities suggesting organized distribution rather than personal use. Cross-referencing prescription records with patient interviews revealed that many patients had received fewer medications than documented, while the excess supplies were apparently being sold through networks that extended beyond the medical practice. Patient safety violations documented through our investigation created the most compelling evidence for prosecution. 23 patients had suffered preventable complications from unnecessary cardiac procedures that Marcus had recommended for financial rather than medical reasons. 7 patients had died from surgical complications that resulted from procedures performed by inadequately supervised residents, while Marcus was conducting personal business elsewhere. The unnecessary surgery documentation included detailed medical analysis, showing that alternative treatments would have been more appropriate for specific patient conditions. Marcus had been systematically recommending surgical interventions that generated maximum insurance reimbursements while exposing patients to risks that weren't medically justified. Each case represented potential medical malpractice claims in addition to criminal fraud charges. Financial forensics revealed sophisticated money laundering schemes that transformed criminal proceeds into apparently legitimate investments. Marcus had been using offshore consulting agreements with medical device companies to disguise kickbacks as legitimate research payments, while pharmaceutical company grants were actually payments for recommending specific medications regardless of patient needs. The medical device kickback schemes involved systematic bias in Marcus's surgical recommendations toward products manufactured by companies that provided him with consulting fees and research grants. Patients received cardiac devices that were more expensive and sometimes less effective than alternatives, but which generated higher profits for both Marcus and his corporate partners. This created conflicts of interest that violated medical ethics while defrauding insurance companies and endangering patients. Research fraud emerged as another significant component of Marcus's criminal activities. Clinical trial data had been systematically falsified to support pharmaceutical company applications for FDA approval of cardiac medications. Marcus had been reporting positive outcomes for drugs that had actually caused adverse reactions in patients, while suppressing negative data that would have prevented regulatory approval. The falsified research involved coordination with other medical professionals at institutions throughout California, suggesting a broader conspiracy that extended far beyond Sterling Cardiovascular Institute. Communications recovered from encrypted systems revealed discussions about data management that actually described systematic falsification of clinical trial results for financial benefit. Insurance fraud extended beyond individual billing irregularities to include systematic manipulation of patient diagnoses to justify unnecessary procedures. Marcus had been coaching patients to report symptoms that would support more complex surgical interventions, while medical records were altered to create documentation that justified expensive procedures for conditions that didn't actually require surgical treatment. The diagnostic manipulation involved coordination with other physicians who provided second opinions that supported Marcus's surgical recommendations regardless of actual medical evidence. This created circular referral systems where multiple doctors provided false confirmations of surgical necessity while sharing the profits from fraudulent procedures. Property asset analysis revealed that Marcus had been using criminal proceeds to acquire real estate investments throughout California, medical equipment that was then leased back to his own practice for inflated fees and ownership stakes in biotechnology companies that he influenced through his research activities. These investments created additional money laundering violations while demonstrating the systematic nature of his criminal planning. The most shocking discovery involved Marcus's systematic targeting of elderly patients with comprehensive Medicare coverage for unnecessary cardiac procedures. Elderly patients were less likely to seek second opinions and more likely to trust authoritative medical recommendations, making them ideal victims for surgical fraud. Marcus had been recommending cardiac procedures for patients whose conditions were stable, creating unnecessary surgical risks while generating maximum insurance reimbursements. Electronic medical record manipulation revealed sophisticated techniques for altering patient data to support fraudulent billing. Surgical times were systematically extended to justify higher reimbursement codes, while post-operative complications were minimized in documentation to avoid questions about surgical quality. This created false medical histories that could affect patients' future medical care, while supporting Marcus's fraudulent billing schemes. The evidence-gathering phase also revealed Marcus's systematic exploitation of medical residents and junior physicians who were pressured to participate in fraudulent activities as a condition of completing their training programs. Young doctors who questioned ethical violations were threatened with negative evaluations that could destroy their medical careers, creating a culture of fear that protected Marcus's criminal activities while corrupting the medical education process. The breakthrough that transformed our investigation from systematic fraud documentation to international criminal conspiracy came through Ryan Park's deep analysis of Marcus's encrypted communications with medical colleagues overseas. What we initially assumed were professional networking relationships with cardiac surgeons in Mexico, Eastern Europe, and Southeast Asia actually represented coordination nodes in a global organ trafficking network that used legitimate medical conferences and research collaborations as cover for criminal activities. The first indication came from travel records showing that Marcus's international conference attendance didn't correlate with his presentations or published research. He had been traveling to medical facilities in Tijuana, Prague, and Bangkok during periods when major cardiac surgery conferences were occurring in completely different locations. These trips were funded through research grants from pharmaceutical companies, but the actual activities bore no resemblance to legitimate medical research. Communications recovered from Marcus's encrypted messaging systems revealed discussions about organ procurement opportunities and transplant candidate preparation that initially appeared to reference legitimate cardiac surgery coordination between international medical centers. However, cross-referencing with patient records revealed that several of Marcus's cardiac surgery patients had died from complications that weren't consistent with their documented procedures, while their organs had been harvested under circumstances that suggested coordinated trafficking rather than medical necessity. The organ trafficking evidence included detailed financial records showing payments from international medical facilities for biological materials that corresponded with dates when Marcus's patients had died from unexpected surgical complications. These payments were disguised as consulting fees and research grants, but the amounts and timing suggested compensation for organs that were being harvested during supposedly routine cardiac procedures. Dr. Volkov's role in the organ trafficking operation became clear through recovered communications, showing her coordination with anesthesiologists at international medical facilities. Her expertise in maintaining patients in stable condition during extended procedures was apparently being used to optimize organ viability during harvesting operations that were conducted under the guise of failed cardiac surgeries. The international scope of Marcus's criminal activities explained the sophisticated financial systems we had discovered during our forensic accounting analysis. Money laundering through offshore medical consulting agreements wasn't just hiding surgical fraud proceeds. It was facilitating payments for organs trafficked through a network that extended across multiple continents and involved dozens of medical professionals. Patient selection criteria for organ trafficking became apparent through analysis of Marcus's surgical scheduling and patient demographics. Cardiac surgery patients who were elderly, had limited family support, or lacked comprehensive medical insurance were more likely to experience complications that resulted in death and subsequent organ harvesting. This systematic targeting of vulnerable patients represented the most horrific dimension of Marcus's transformation from cardiac surgeon to criminal entrepreneur. The organ trafficking revelations explained several anomalies in Marcus's medical practice that had puzzled us during initial evidence gathering. His insistence on performing certain cardiac procedures without adequate medical justification wasn't just about billing fraud, it was about creating opportunities for organ harvesting when patients experienced unexpected complications during surgery. Communications with international criminal associates revealed that Marcus had been providing medical expertise for trafficking operations that extended far beyond organ harvesting. His surgical skills and medical credentials were being used to facilitate human trafficking operations where victims required medical treatment to maintain their value to criminal organizations. The international criminal network included corrupt officials in multiple countries who provided protection for trafficking operations while facilitating the movement of biological materials across international borders. Marcus's legitimate medical research activities provided cover for coordinating with officials who ensured that organ shipments weren't subjected to careful inspection by customs or medical regulatory authorities. Research fraud took on new significance when viewed as part of the organ trafficking operations. Clinical trial data was being falsified not just to support pharmaceutical company applications, but to provide medical documentation that supported illegal organ transplant procedures in countries with less stringent medical oversight. False research papers created legitimacy for transplant techniques that were actually being used to install trafficked organs in wealthy patients who paid premium prices for black market procedures. The pharmaceutical company relationships that had generated consulting fees and research grants were actually facilitating access to medications and medical equipment necessary for organ trafficking operations. Immunosuppressive drugs required for organ transplants were being diverted from legitimate medical supplies to support illegal transplant procedures, while surgical equipment was being shipped to international facilities under the guise of medical research collaboration. Financial analysis revealed that organ trafficking proceeds far exceeded the income Marcus was generating through surgical fraud at Sterling Cardiovascular Institute. Organs harvested from a single patient could generate hundreds of thousands of dollars in international markets, making the trafficking operations far more profitable than traditional medical fraud, while creating international criminal exposure that would trigger federal terrorism and organized crime statutes. The scope of the international conspiracy explained Marcus's confidence in his legal immunity and his willingness to risk increasingly serious criminal activities. He apparently believed that international criminal connections would provide protection from American law enforcement while generating wealth that would allow him to escape prosecution if his domestic criminal activities were discovered. This revelation transformed our investigation from a complex medical fraud case into a national security matter that would require coordination with federal agencies specializing in international organized crime and human trafficking. The evidence we had assembled would need to be shared with Interpol, the FBI's International Crime Division, and specialized prosecutors who handled terrorism and trafficking cases. The partnership agreement that Marcus had trusted to protect his medical practice assets would prove completely irrelevant once federal prosecutors identified him as a participant in international organ trafficking operations. His domestic assets would be subject to forfeiture under federal organized crime statutes, while his international criminal activities would ensure prosecution under terrorism laws that carried mandatory life sentences. The man I had married no longer existed, replaced by a criminal whose activities threatened not just patients in California, but vulnerable people throughout the international trafficking network he had helped create and coordinate. The discovery of Marcus's involvement in international organ trafficking had opened a door to criminal activities so extensive that our investigation team found ourselves documenting evidence of what federal prosecutors would later describe as one of the most sophisticated medical crime syndicates in modern history. Ryan Park's continued analysis of encrypted communications revealed that Sterling Cardiovascular Institute wasn't just participating in organ trafficking, it was serving as the North American headquarters for a global network that coordinated medical crimes across 6 continents. The encrypted server systems that Marcus had been using to coordinate with international criminal associates contained detailed records of organ trafficking operations spanning 4 years. Patient databases included not just California victims, but individuals from Mexico, Guatemala, and other Central American countries who had been transported to Marcus's facility for cardiac consultations that actually represented organ harvesting evaluations. Cross-referencing patient records with immigration databases revealed that many of Marcus's international patients were undocumented immigrants who had been promised free cardiac care in exchange for medical examinations that were actually organ compatibility assessments. These vulnerable individuals were ideal trafficking victims because their disappearances were unlikely to trigger law enforcement investigations, while their medical information could be used to match them with wealthy patients requiring organ transplants. The most disturbing revelation came from analyzing Marcus's research partnerships with medical facilities in countries known for human trafficking. Communications recovered from encrypted systems showed coordination with facilities in Eastern Europe, Southeast Asia, and South America that were conducting clinical trials involving organ transplant techniques. These supposed research projects were actually cover operations for trafficking networks that provided organs to wealthy patients in countries with more stringent medical oversight. Dr. Volkov's role in the international conspiracy extended far beyond her participation in domestic fraud. Her anesthesiology expertise was being used to coordinate with medical professionals throughout the trafficking network, ensuring that organ harvesting procedures were conducted with technical precision that maximized organ viability while minimizing evidence of criminal activity. Communications showed her providing training to anesthesiologists at international facilities, sharing techniques for maintaining patients during extended harvesting procedures. The pharmaceutical company relationships that had initially appeared to involve simple kickbacks and research fraud were actually facilitating international drug trafficking operations that supported the organ harvesting network. Immunosuppressive medications, surgical anesthetics, and post-operative care drugs were being diverted from legitimate medical supplies to support trafficking operations worldwide. These diversions involved millions of dollars in pharmaceutical products while creating drug shortages at legitimate medical facilities. Financial forensics revealed that Marcus had been laundering organ trafficking proceeds through sophisticated investment schemes that involved real estate development projects, biotechnology, startup investments, and medical equipment leasing operations. The complexity of these money laundering systems suggested coordination with international criminal organizations that specialized in moving large amounts of illicit funds through legitimate business channels. The biotechnology investments were particularly significant because they provided Marcus with influence over medical device development and pharmaceutical research that could be manipulated to support trafficking operations. His investments in companies developing organ preservation technologies and transplant-related medical devices created conflicts of interest that extended far beyond simple financial fraud into systematic corruption of medical innovation processes. Research fraud took on international dimensions when viewed as part of the trafficking network coordination. Clinical trials were being conducted at facilities worldwide using organs obtained through trafficking operations, while research results were being falsified to support regulatory approvals for transplant procedures and medical devices that facilitated criminal activities. This created a feedback loop where trafficking proceeds funded research that improved trafficking capabilities while providing legitimate cover for criminal operations. The international scope of Marcus's criminal network explained several puzzling aspects of his domestic operations that our team had identified during initial evidence gathering. His systematic targeting of vulnerable patient populations wasn't just about maximizing domestic fraud proceeds, it was about identifying potential trafficking victims while building cover stories that would explain patient disappearances or unexpected deaths. Communications with international criminal associates revealed that Marcus had been coordinating with human trafficking organizations that provided victims for organ harvesting while offering medical services to facilitate other trafficking operations. His surgical expertise was being used to treat injuries sustained by trafficking victims, perform cosmetic procedures that changed victim appearances, and provide medical documentation that supported false identity creation for criminal organizations. The medical equipment and facility modifications that Marcus had been implementing at Sterling Cardiovascular Institute were designed to support trafficking operations rather than improve legitimate patient care. Hidden surgical suites contained equipment specifically configured for organ harvesting, while modified storage facilities were designed to preserve organs during transportation to international transplant facilities. Security system modifications at the medical facility included surveillance equipment and access controls that protected trafficking operations from detection while providing early warning of law enforcement interest. Marcus had essentially transformed a legitimate cardiac surgery practice into a fortified criminal operations center that facilitated international trafficking while maintaining the appearance of routine medical care. Patient selection algorithms that Marcus had developed weren't just identifying candidates for unnecessary cardiac procedures. They were screening potential trafficking victims based on organ compatibility, family support systems, and likelihood of disappearance investigation. This systematic approach to victim identification represented criminal sophistication that elevated Marcus's activities from medical fraud to organized crime leadership. The international criminal network included corrupt law enforcement officials, government regulators, and medical licensing authorities who provided protection for trafficking operations while ensuring that investigations were misdirected or terminated before discovering criminal activities. Marcus's coordination with these corrupt officials created a protection network that extended across multiple countries and jurisdictions. Evidence recovered from Marcus's communications revealed that he had been planning to expand trafficking operations into pediatric organ harvesting, targeting children from Central American families seeking medical care for congenital heart conditions. This planned expansion into pediatric trafficking represented the most horrific dimension of his criminal evolution and would trigger prosecution under international terrorism statutes designed to protect children from exploitation. The scope of Marcus's international criminal activities explained his confidence in evading prosecution despite the obvious risks of his domestic fraud operations. He apparently believed that international criminal connections would provide protection from American law enforcement while generating sufficient wealth to escape consequences if his activities were discovered. This overconfidence would prove to be his most significant miscalculation. The international scope of Marcus's criminal enterprise required a level of law enforcement and prosecutorial expertise that extended far beyond our initial team's capabilities. Detective Ray Morrison's contacts at the federal level opened doors to specialized agencies that investigated international organized crime, human trafficking, and terrorism crimes that carried the most severe penalties available under American law while triggering international cooperation agreements with dozens of countries. Special Agent Patricia Kane from the FBI's International Organized Crime Unit became our primary federal law enforcement coordinator. Agent Kane had spent 15 years investigating human trafficking networks and medical crimes that crossed international borders, developing expertise in the sophisticated financial systems and operational methods that characterized major criminal organizations. Her assessment of our evidence was both sobering and encouraging. Marcus's crimes were serious enough to warrant the full attention of federal law enforcement, while our documentation was comprehensive enough to support successful prosecution. Dr. Chen, Agent Kane explained during our first federal briefing, "What you've uncovered represents one of the most significant medical crime syndicates we've investigated. Your husband's activities threaten not just American patients, but vulnerable populations throughout the Americas and beyond. This case will require coordination with Interpol international terrorism task forces and specialized prosecutors who handle crimes against humanity." The federal team included Dr. Rebecca Martinez, a medical investigator with the Department of Health and Human Services, who specialized in international medical fraud and trafficking. Dr. Martinez's expertise would be crucial for understanding the medical aspects of organ trafficking while ensuring that our evidence met the technical standards required for prosecution under complex federal statutes. Her previous work investigating international medical crimes provided insights into criminal methods and organizational structures that would prove invaluable for building comprehensive cases against Marcus and his associates. Agent David Chen from Immigration and Customs Enforcement brought expertise in international trafficking investigations and cross-border criminal operations. His analysis of Marcus's international activities revealed coordination with trafficking networks that extended throughout Central America, Eastern Europe, and Southeast Asia. These criminal connections would trigger additional federal charges while providing opportunities to dismantle trafficking operations that had been exploiting vulnerable populations for years. The international coordination required specialists who understood the legal and practical challenges of building cases that spanned multiple countries and legal systems. Attorney General's Office prosecutor Maria Santos had spent 8 years coordinating international criminal cases involving medical professionals and trafficking organizations. Her experience would ensure that evidence gathered in the United States could be used to support prosecutions in other countries while protecting the integrity of domestic cases. Financial crimes specialist Robert Kim from the Treasury Department's Financial Crimes Enforcement Network provided expertise in international money laundering investigations. His analysis of Marcus's financial activities revealed sophisticated schemes that involved dozens of financial institutions across multiple countries creating money trails that would support asset forfeiture proceedings while demonstrating the international scope of the criminal enterprise. The medical expert team expanded to include Dr. Elena Rodriguez, a cardiac surgery specialist who had assisted with previous medical fraud prosecutions. Dr. Rodriguez's role would be crucial for explaining to juries how Marcus's procedures deviated from standard medical practice, while demonstrating the relationship between unnecessary surgeries and organ trafficking operations. Her testimony would provide the medical foundation for proving that Marcus's activities constituted criminal conspiracy rather than simple malpractice. Victim advocacy required specialists who understood the unique challenges faced by trafficking survivors and families of patients harmed by medical crimes. Isabella Martinez from the International Justice Mission brought expertise in supporting trafficking victims while coordinating with law enforcement to ensure that survivors received appropriate services during lengthy prosecution processes. Her involvement would ensure that victims' voices were heard during proceedings, while providing comprehensive support for individuals traumatized by their experiences. Digital forensics capabilities expanded with the addition of Agent Lisa Park from the FBI's Cybercrime Division. Agent Park's expertise in international digital investigations would be essential for tracking communications between Marcus and criminal associates worldwide, while recovering evidence from sophisticated encryption systems designed to protect criminal activities from law enforcement detection. International legal coordination required specialists who understood the complex procedures for gathering evidence across borders while ensuring that prosecutions met the standards required by various international legal systems. Attorney Jennifer Walsh's expertise in medical law provided the foundation, but international cases required additional expertise from federal prosecutors who specialized in cross-border criminal investigations. The victim identification process required coordination with missing persons databases, immigration authorities, and international law enforcement agencies to identify individuals who had been harmed by Marcus's trafficking operations. Detective Morrison's contacts with state and local law enforcement provided access to cold case files that might contain evidence of Marcus's earlier criminal activities, while federal agents coordinated with Interpol to identify international victims. Medical regulatory coordination involves specialists from medical licensing boards throughout the United States and international medical regulatory authorities who could ensure that Marcus and his associates faced professional sanctions in addition to criminal penalties. This coordination would prevent traffickers from simply relocating their operations to different jurisdictions while ensuring that medical professionals who participated in criminal activities lost their licenses permanently. The prosecution team required attorneys who specialized in different aspects of federal criminal law terrorism statutes for crimes involving international trafficking networks, organized crime laws for conspiracy charges, medical fraud regulations for domestic crimes, and asset forfeiture procedures for seizing criminal proceeds. Each specialization required different evidence standards and prosecution strategies, creating complex coordination challenges that would test the limits of the federal justice system. Security considerations required protective services for witnesses and investigators who face potential retaliation from international criminal organizations. Federal marshals coordinated with local law enforcement to provide security for our team members, while ensuring that evidence remained protected from tampering or destruction attempts by criminal associates who might learn about the investigation. Intelligence coordination involved sharing information with federal agencies that monitored international criminal organizations and trafficking networks. The evidence we had gathered about Marcus's activities provided intelligence that would support investigations of criminal networks throughout the Americas, while demonstrating the connections between medical fraud and international organized crime. The comprehensive expert team that assembled around our investigation represented the largest coordination of federal, state, and international resources ever dedicated to prosecuting medical crimes involving international trafficking. Marcus's confidence in his criminal immunity would be tested by law enforcement capabilities that he had never imagined could be focused on his activities. The expertise assembled for prosecuting Marcus's crimes would ensure that he faced consequences proportionate to the enormous harm his activities had caused to vulnerable populations throughout the international trafficking network he had helped create and coordinate. His transformation from respected cardiac surgeon to international criminal would result in prosecution under the most severe statutes available to American law enforcement. The revelation that would ultimately provide the final pieces of evidence necessary for Marcus's complete destruction came from the most unexpected source, his own mother, Dr. Margaret Sterling, the 67-year-old retired chief of staff at Palo Alto Presbyterian Hospital. Margaret had always been a formidable woman, but I had never fully appreciated the moral steel beneath her elegant medical establishment exterior until she appeared at my office Thursday morning with a briefcase full of documents and a look of grim determination that transformed her aristocratic features into something far more dangerous. Margaret's decision to investigate her own son had been triggered by increasingly suspicious changes in his behavior and spending patterns that she had noticed during family gatherings over the past 18 months. As someone who had spent 40 years navigating hospital politics and medical ethics challenges, she recognized signs of corruption and criminal activity that others might have dismissed as professional success. Her medical background and connections throughout California's healthcare establishment had provided her with access to information that even our comprehensive investigation hadn't uncovered. "Sophia," Margaret said quietly as she opened her briefcase, "I've been documenting Marcus's activities for 8 months. What started as maternal concern about his changed behavior has revealed criminal activities that threaten everything our family has worked to build in the medical community. My son has become a monster, and I can't protect him from the consequences of choices that have harmed innocent people." The documents Margaret provided revealed that she had been conducting her own investigation with the thoroughness of someone who understood the importance of proper evidence gathering. Her documentation included photographs, financial records, and correspondence that provided missing pieces of Marcus's criminal timeline while revealing activities that had occurred before our investigation began. Her access to medical community networks had allowed her to gather information that would have taken law enforcement months to develop independently. The most significant evidence Margaret provided concerned Marcus's relationship with Dr. Vincent Calabresi, a Providence-based medical equipment dealer who specialized in providing surgical instruments and organ preservation technology to medical facilities throughout New England. Margaret's photographs showed Marcus meeting with Calabresi at exclusive medical conferences and private clubs locations where their conversations couldn't be monitored by routine law enforcement surveillance. These meetings had been occurring monthly for over 3 years, suggesting a sophisticated and ongoing criminal partnership that extended far beyond the timeframe of our documented evidence. Financial records that Margaret had obtained through her medical community connections showed payments from Calabresi's companies to Marcus disguised as consulting fees and research grants, but the amounts and timing suggested compensation for organ trafficking coordination rather than legitimate medical consulting. Margaret's investigation had also revealed that Marcus's medical practice partnership was being used as a front for Calabresi's organ trafficking operations, with legitimate cardiac surgeries being mixed with trafficking activities to create cover for criminal operations. This arrangement had allowed Marcus to accumulate wealth far beyond what his cardiac surgery practice could generate legitimately while providing Calabresi with access to medical facilities and expertise necessary for sophisticated trafficking operations. The documentation Margaret had assembled revealed that several other prominent cardiac surgeons throughout California were involved in Calabresi's trafficking network, creating a criminal conspiracy that extended throughout some of the state's most respected medical institutions. This information explained how Marcus had been able to operate his trafficking schemes without detection by medical colleagues, as they were equally invested in maintaining the network's criminal activities. Margaret's most shocking revelation concerned Marcus's relationship with Dr. Natasha Volkov, which had been orchestrated by Calabrese as part of a broader scheme to compromise Marcus's judgment and increase his dependence on the criminal organization. Natasha had been working as an informant for Calabrese long before she joined Sterling Cardiovascular Institute, with her seduction of Marcus being carefully planned to ensure his continued cooperation with trafficking operations. The evidence Margaret provided included recordings of conversations between Marcus and Natasha that revealed the systematic nature of their criminal planning. These recordings, obtained through surveillance equipment that Margaret had installed in Marcus's home office, captured detailed discussions about organ harvesting procedures, patient selection criteria, and coordination with international trafficking networks. Marcus's own words would provide prosecutors with direct evidence of his criminal intent and leadership role in the conspiracy. Margaret's decision to betray her son represented a profound moral choice that would destroy her family while potentially saving countless lives. Her cooperation with our investigation demonstrated that Marcus's criminal activities had alienated even those who should have been most loyal to him, providing powerful testimony about the systematic nature of his transformation from respected physician to criminal entrepreneur. The personal cost of Margaret's decision was enormous. Her revelation of Marcus's crimes would destroy the Sterling family's reputation within California's medical community, while ensuring that she faced social ostracism from colleagues who had respected the family for decades. Her choice to prioritize patient safety over family loyalty represented the kind of moral courage that would prove essential for dismantling the criminal network that Marcus had helped create. Margaret's evidence also revealed that Marcus had been planning to eliminate potential witnesses against him, including several former patients who had survived trafficking attempts, and threatened to expose his activities. Her recordings captured Marcus discussing plans to arrange accidents for individuals who posed threats to the trafficking network, demonstrating his willingness to use murder as a solution to legal problems. The family betrayal represented by Margaret's cooperation would provide prosecutors with evidence that Marcus's own mother considered him irredeemably dangerous to public safety. Her willingness to testify against her son would create powerful testimony about the systematic nature of his criminal activities, while demonstrating that even family members recognized the necessity of stopping his trafficking operations. The comprehensive evidence assembled through 8 weeks of intensive investigation revealed that Dr. Marcus Sterling had transformed Sterling Cardiovascular Institute into the North American headquarters of an international organ trafficking syndicate that generated over $50 million annually while causing preventable deaths throughout Central America, Eastern Europe, and Southeast Asia. The scope of his criminal enterprise extended far beyond medical fraud into systematic human trafficking that threatened vulnerable populations across multiple continents. Marcus's trafficking network included corrupt medical professionals at 23 facilities across 6 countries, government officials who provided protection for criminal operations, and financial institutions that laundered trafficking proceeds through sophisticated investment schemes. His coordination role in this international conspiracy had made him one of the most significant organ trafficking figures in the Western Hemisphere, while providing evidence that would support prosecutions throughout the criminal network. The patient victims of Marcus's domestic operations included 847 individuals who had been subjected to unnecessary cardiac procedures, 156 patients who had suffered preventable complications from fraudulent surgeries, and 34 deaths that resulted directly from Marcus's criminal activities. International victims included over 200 trafficking survivors from Central America and Eastern Europe who had been transported to California for organ harvesting procedures disguised as cardiac consultations. Financial analysis revealed that Marcus had accumulated over $15 million in legitimate assets through his medical practice, while laundering an additional $23 million in trafficking proceeds through real estate investments, biotechnology companies, and offshore financial accounts. These assets would be subject to complete forfeiture under federal organized crime statutes, while providing compensation for victims harmed by his criminal activities. The evidence documented 127 separate federal crimes, including racketeering, international human trafficking, medical fraud, money laundering, conspiracy to commit murder, and terrorism charges related to his coordination with international criminal organizations. Each charge carried substantial prison sentences, with several statutes requiring mandatory life imprisonment for trafficking crimes involving international conspiracy. The international cooperation triggered by Marcus's case would result in investigations of trafficking networks throughout the Americas, while providing intelligence that would support prosecutions of criminal organizations that had been exploiting vulnerable populations for years. His arrest would mark the beginning of the largest international medical trafficking prosecution in history. Natasha Volkov faced identical charges for her coordination role in trafficking operations, while Margaret Sterling's cooperation had earned her immunity from prosecution despite her inadvertent assistance with Marcus's early criminal activities. The family dynamics that had protected Marcus's reputation would now ensure his complete destruction as his mother testified about his transformation into an international criminal. The partnership agreement that Marcus had trusted to protect his medical practice assets would prove completely irrelevant once federal prosecutors identified him as the leader of an international trafficking syndicate. His domestic fraud violations had provided the evidence trail that exposed criminal activities threatening national security and international stability, ensuring prosecution under the most severe statutes available to American law enforcement. The first indication that Marcus sensed the walls closing around his criminal empire came Friday morning when his attempts to access several offshore banking accounts were blocked by what the financial institutions described as routine compliance reviews pending regulatory clarification. His carefully controlled facade began showing cracks as he made increasingly agitated phone calls to banking officials in Switzerland, the Cayman Islands, and Luxembourg, demanding explanations for restrictions that were actually the result of federal asset freezing orders coordinated through international law enforcement cooperation agreements. From my office at Stanford Medical Center, I monitored Marcus's growing desperation through surveillance systems that federal agents had installed throughout our home and his medical practice. His confident demeanor was being replaced by visible anxiety that he couldn't quite conceal from his colleagues at Sterling Cardiovascular Institute, though he maintained his professional performance with the skill of someone who had been living a double life for years. Dr. Natasha Volkov had begun exhibiting similar signs of stress, her usually perfect appearance showing subtle deterioration that suggested sleepless nights and growing paranoia about the federal investigation that she sensed but couldn't identify. Her interactions with other medical staff had become increasingly tense, particularly when discussions involved patient records or financial procedures that might contain evidence of her participation in Marcus's trafficking operations. The pressure campaign that Agent Kane had designed was working exactly as intended: systematic restrictions on Marcus's access to criminal resources, while maintaining the appearance of routine administrative processes that wouldn't immediately alert him to the comprehensive investigation that was preparing to destroy his criminal enterprise. Each blocked transaction and delayed approval created additional stress while preventing him from taking protective measures that might compromise our evidence gathering. Marcus's attempts to contact his international criminal associates revealed the extent of his growing desperation as encrypted communications that federal agents were monitoring showed increasingly frantic requests for advice and assistance. Vincent Calabrese and other members of the trafficking network had apparently decided that Marcus had become a liability, as their responses were evasive and non-committal, rather than the supportive reassurances he clearly expected from criminal partnerships that had generated millions of dollars in illegal profits. The international criminal network that had provided Marcus with protection and resources was beginning to distance itself from his activities as federal pressure mounted on trafficking operations throughout Central America and Eastern Europe. Intelligence gathered from Marcus's case had triggered coordinated investigations by law enforcement agencies in 12 countries, creating pressure on criminal organizations that were prioritizing their own survival over loyalty to individual trafficking coordinators. Sterling Cardiovascular Institute was experiencing operational difficulties that reflected the systematic pressure being applied to Marcus's criminal infrastructure. Medical equipment deliveries were being delayed by customs inspections that discovered irregularities in international shipping documentation, while pharmaceutical supplies were being questioned by regulatory authorities who had identified suspicious ordering patterns that supported trafficking operations rather than legitimate medical practice. The financial pressure was particularly effective because Marcus's criminal operations required constant cash flow to maintain international coordination, pay bribes to corrupt officials, and fund the sophisticated logistics necessary for moving organs across international borders. Federal asset freezing had disrupted these financial flows while creating uncertainty about future operations that was causing friction between Marcus and his criminal associates. Patient scheduling irregularities at Sterling Cardiovascular Institute reflected Marcus's increasing difficulty maintaining normal medical practice operations while managing a criminal enterprise under federal investigation. Surgeries were being postponed or reassigned to other physicians as Marcus struggled to balance his trafficking coordination responsibilities with the legitimate medical activities that provided cover for his criminal operations. Hospital security had been quietly enhanced through federal coordination with additional surveillance systems, monitoring Marcus's activities, while protective measures ensured that potential witnesses and victims remained safe from retaliation attempts. These security measures were disguised as routine safety upgrades that wouldn't immediately alert Marcus to the law enforcement attention focused on his activities. The psychological pressure of maintaining his innocent facade while knowing that his criminal empire was under systematic attack was beginning to affect Marcus's decision-making capabilities. Federal behavioral analysts had predicted that sustained pressure would force him to make increasingly desperate choices that would provide additional evidence of his criminal activities while demonstrating his dangerousness to public safety. The partnership agreement that had once represented Marcus's confidence in his legal immunity was about to be tested by federal prosecution procedures that would strip away every protection he had believed would shield him from the consequences of his transformation from cardiac surgeon to international criminal. The breaking point came Tuesday morning when Marcus discovered that his medical license was under routine review by the California Medical Board, a process that effectively suspended his ability to perform surgeries while investigators examined his professional conduct. His carefully constructed world began collapsing as Sterling Cardiovascular Institute's surgical schedule was thrown into chaos, with dozens of procedures being reassigned to other cardiac surgeons throughout the Bay Area medical community. Marcus's attempts to reach Vincent Calabrese became increasingly desperate as encrypted communications revealed his panic about losing access to the medical facilities and credentials that were essential for trafficking operations. Calabrese's responses had become openly hostile, suggesting that the criminal organization viewed Marcus as a compromised asset who threatened the entire network's security. The criminal partnership that had generated millions in illegal profits was disintegrating as federal pressure mounted on trafficking operations worldwide. The medical equipment restrictions that had begun as seemingly routine administrative delays escalated into comprehensive blockades that prevented Sterling Cardiovascular Institute from obtaining the specialized instruments necessary for both legitimate cardiac surgery and organ harvesting operations. Federal coordination with medical device manufacturers had resulted in flagging systems that prevented Marcus from acquiring equipment that could be used for trafficking while maintaining plausible deniability about law enforcement involvement. Dr. Natasha Volkov's behavior became increasingly erratic as the pressure mounted, with hospital staff reporting that she had been seen destroying documents and attempting to access computer systems outside her normal responsibilities. Her attempts to eliminate evidence were being monitored in real time by federal agents, providing additional proof of her consciousness of guilt while demonstrating the systematic nature of the criminal conspiracy she had helped coordinate. The financial noose tightened further when Marcus's attempts to liquidate real estate investments were blocked by title companies that discovered irregularities in property ownership documentation. These irregularities were actually the result of federal seizure proceedings that had been initiated under asset forfeiture laws. But the bureaucratic language disguised the true nature of the restrictions while preventing Marcus from accessing funds that could facilitate his escape from prosecution. Patient complaints began surfacing at an alarming rate as families of Marcus's previous surgical patients started questioning procedures that had seemed medically unnecessary at the time. These complaints were being coordinated through victim advocacy organizations that federal agents had discreetly contacted, creating a cascade of evidence that demonstrated the systematic nature of Marcus's fraud while building public pressure for accountability. The international criminal network's abandonment of Marcus became apparent when communications intercepts revealed that other trafficking coordinators were being instructed to sever all connections with Sterling Cardiovascular Institute operations. The criminal organization was implementing damage control procedures that sacrificed Marcus and his operation to protect more valuable assets throughout the trafficking network. Hospital administration at Palo Alto Presbyterian began raising questions about the unusual number of post-operative complications and patient deaths associated with Marcus's procedures over the past 3 years. These inquiries were being encouraged by federal agents who provided hospital administrators with statistical analyses that demonstrated patterns requiring immediate investigation under patient safety protocols. Marcus's home behavior revealed the psychological toll of sustained pressure, as surveillance systems captured his increasing paranoia, sleepless nights, and erratic decision-making that suggested someone who understood his situation was deteriorating rapidly. His attempts to maintain normal domestic routines with me were becoming increasingly forced and artificial, as he struggled to conceal his growing desperation about the federal investigation that he sensed but couldn't identify. The final escalation of pressure came when Marcus received notification that the DEA was conducting a routine audit of controlled substance prescribing practices at Sterling Cardiovascular Institute. This audit would inevitably discover the drug diversion schemes that had been supplying medications for trafficking operations while providing additional federal charges that carried mandatory minimum sentences. Margaret Sterling's decision to cooperate with federal investigators had provided the final pieces of evidence necessary for comprehensive prosecution, while her willingness to testify against her son demonstrated that even family members recognized the necessity of stopping his criminal activities. Her moral courage in choosing patient safety over family loyalty would prove decisive in ensuring Marcus faced appropriate consequences. The comprehensive pressure campaign had achieved its intended effect. Marcus was becoming increasingly isolated from criminal associates, denied access to resources necessary for continuing trafficking operations, and forced into increasingly desperate decisions that would provide additional evidence of his guilt, while demonstrating his ongoing dangerousness to public safety. The partnership agreement that had once symbolized Marcus's confidence in his legal immunity was about to be tested by federal prosecution procedures that would demonstrate the complete irrelevance of civil contracts when faced with international criminal conspiracy charges carrying mandatory life sentences. The dam of silence that had protected Marcus's criminal activities for years finally burst when Maria Gonzalez, a 34-year-old mother of 3 from San Jose, became the first victim to publicly testify about her family's devastating experience with Sterling Cardiovascular Institute. Maria's 8-year-old son, Diego, had been referred to Marcus for treatment of a minor heart murmur that required monitoring but not surgical intervention. Instead, Marcus had convinced the family that Diego needed immediate cardiac surgery to prevent life-threatening complications. Dr. Sterling told us that Diego would die without surgery, Maria testified through tears during the federal victim impact hearing. He showed us charts and medical studies that made us terrified for our son's life. We trusted him because he was supposed to be the best cardiac surgeon in California. We never imagined that he was lying to steal from our insurance while putting Diego at risk for procedures he didn't need. Diego's unnecessary cardiac surgery had resulted in complications that required additional procedures, creating medical problems that the healthy child had never experienced before trusting his care to Marcus. The family's insurance had been billed over $340,000 for procedures that medical experts would later testify were not only unnecessary, but contraindicated for Diego's actual condition. More devastating than the financial fraud was the permanent heart damage that Diego suffered from surgical complications that should never have occurred. The second victim to come forward was Dr. Elena Rodriguez, a 45-year-old emergency room physician who had sought Marcus's consultation for cardiac symptoms that were later determined to be anxiety-related, rather than indicative of heart disease. Marcus had convinced Dr. Rodriguez that she was experiencing early stages of cardiac failure that required immediate intervention through experimental procedures that he claimed were breakthrough treatments available only at Sterling Cardiovascular Institute. As a physician myself, I should have been more skeptical, Dr. Rodriguez testified during her federal victim impact statement. But Marcus presented evidence that seemed compelling, and I was terrified by the possibility that my medical career could be ended by heart disease. He exploited my trust in the medical profession and my fear about my own health to convince me to undergo procedures that nearly killed me. Dr. Rodriguez's case was particularly significant because her medical expertise allowed her to provide detailed testimony about how Marcus had manipulated diagnostic tests and misrepresented research data to justify unnecessary procedures. Her analysis of the medical records revealed systematic falsification of test results and deliberate misinterpretation of cardiac imaging that created false evidence of heart disease requiring surgical intervention. The international victims began testifying through federal prosecutors who had coordinated with law enforcement agencies throughout Central America and Eastern Europe. Carmen Gutierrez, a 23-year-old woman from Guatemala, had been promised free cardiac care for her infant daughter through a medical charity program that was actually a front for organ trafficking evaluation. Carmen and her daughter had been transported to Sterling Cardiovascular Institute for what they believed were routine consultations that would provide life-saving treatment for the child's congenital heart condition. They told us that American doctors could save our baby's life, Carmen testified through an interpreter during video testimony from Guatemala City. We were so grateful for the opportunity that we never questioned why they needed so many medical tests and why they separated me from my daughter for hours during the examinations. We only learned later that they were evaluating her organs for harvesting, rather than planning treatment for her heart condition. Carmen's daughter had been scheduled for what Marcus described as corrective cardiac surgery, but the procedure was actually designed to facilitate organ harvesting while creating documentation that would explain the child's death as the result of surgical complications. Only the intervention of a concerned nursing assistant who reported suspicious activities to hospital security had prevented the trafficking operation from proceeding. The testimony of Dr. James Patterson, a 52-year-old cardiac surgeon from San Francisco, who had been recruited by Marcus to participate in advanced surgical research, revealed the sophisticated methods used to corrupt medical professionals throughout the trafficking network. Dr. Patterson had initially believed that he was participating in legitimate clinical trials involving experimental cardiac procedures, but gradually realized that the research actually involved organ harvesting from patients who had been targeted for trafficking. Marcus presented the research as breakthrough work that would revolutionize cardiac surgery. Dr. Patterson testified during his cooperation agreement proceedings. The financial incentives were substantial, and the prestige of being associated with cutting-edge medical research was appealing to my professional ego. It wasn't until I witnessed procedures that clearly violated medical ethics that I understood the true nature of what we were doing. Dr. Patterson's testimony provided federal prosecutors with detailed evidence about the recruitment methods used to expand the trafficking network, while demonstrating how respected medical professionals could be gradually corrupted through financial incentives and professional manipulation. His cooperation would be essential for identifying other physicians who might have been recruited for trafficking operations throughout California and beyond. The family testimony became particularly compelling when Sandra Chen, no relation to me, a 67-year-old retired teacher, described how Marcus had convinced her elderly husband that he needed emergency cardiac surgery, despite the fact that other cardiologists had recommended less invasive treatments. Marcus had used high-pressure tactics and false medical information to convince the family that immediate surgery was necessary to prevent imminent death. My husband was 89 years old and in relatively good health for his age. Sandra testified during the federal hearing. Other doctors had told us that medication could control his heart rhythm problems, but Dr. Sterling insisted that surgery was the only option. He made us feel that we were endangering my husband's life by seeking second opinions or delaying the procedure. We trusted him because of his reputation, and that trust killed my husband. Sandra's husband had died from complications during what Marcus described as routine cardiac surgery, but medical experts would later testify that the procedure was unnecessary and that the patient's death was preventable. The family's insurance had been billed over $280,000 for procedures that had been designed to generate maximum reimbursements rather than provide appropriate medical care for an elderly patient with manageable cardiac conditions. The nursing staff testimony provided crucial evidence about the systematic nature of Marcus's criminal operations within Sterling Cardiovascular Institute. Rebecca Martinez, a cardiac surgical nurse with 15 years of experience, testified about being pressured to participate in procedures that violated established medical protocols, while being threatened with termination if she reported safety concerns to hospital administration. Dr. Sterling created a culture of fear where questioning his decisions was treated as insubordination, Rebecca testified during her protected witness statement. Nurses who raised concerns about patient safety were transferred to other departments or fired for supposedly unrelated performance issues. We were told that Dr. Sterling's research was too important to be questioned by nursing staff who didn't understand advanced cardiac surgery techniques. Rebecca's testimony revealed that nursing staff had been systematically excluded from portions of surgical procedures that involved organ evaluation and harvesting preparation. Nurses who attempted to maintain normal documentation standards were replaced by personnel who were willing to falsify medical records to support Marcus's billing fraud and trafficking coordination activities. The cumulative impact of victim testimony created an overwhelming record of systematic harm that extended from unnecessary medical procedures affecting California families to international trafficking operations that endangered vulnerable populations throughout the Americas. Each victim's story demonstrated different aspects of Marcus's criminal enterprise while building a comprehensive case for the most severe federal penalties available for medical crimes involving international conspiracy. The transformation of Marcus from desperate criminal to violent predator occurred with shocking suddenness when federal surveillance detected his communications with professional assassins who specialized in eliminating witnesses against organized crime operations. The encrypted messaging systems that had once coordinated organ trafficking activities were now being used to plan multiple murders designed to prevent testimony that would ensure his conviction on federal conspiracy charges. Agent Kane's interception of these communications revealed that Marcus had contacted Viktor Petrov, a Russian-born contract killer, who operated throughout the western United States providing elimination services for criminal organizations. The communications showed Marcus offering $2 million for the immediate assassination of 5 individuals who posed the greatest threats to his criminal empire. His mother, Margaret Sterling, federal prosecutor, Maria Santos, victim advocate Isabella Martinez, and Dr. Elena Rodriguez, whose medical expertise made her testimony particularly damaging. The intercepts show systematic planning for multiple homicides designed to obstruct federal prosecution. Agent Kane explained during the emergency federal coordination meeting that was convened to address the escalating threat. Marcus isn't just planning to eliminate individual witnesses, he's attempting to destroy the entire evidentiary foundation of our case through coordinated violence that would terrorize other potential witnesses into silence. The assassination plans included detailed surveillance information about each target's daily routines, home security systems, and travel patterns that had been compiled over several weeks while federal agents were building their prosecution case. Marcus had been using resources from his trafficking network to conduct comprehensive reconnaissance that would facilitate professional assassinations designed to appear as accidents or random crimes. The most chilling discovery came from Marcus's communications with Petrov about eliminating me through a staged medical emergency that would appear to be the result of a cardiac episode. Marcus's medical expertise was being used to plan my murder through injection of substances that would cause heart failure while leaving minimal forensic evidence that could be detected during a routine autopsy examination. Your husband has been planning to murder you using his knowledge of cardiac medicine to create an untraceable assassination, Agent Kane informed me during the emergency security briefing. He's researched methods for causing cardiac arrest that would appear to be natural death, and he's been coordinating with professional killers who have the technical expertise to implement his medical assassination plans. The plot against Margaret Sterling was equally sophisticated, involving plans to cause what would appear to be an accidental fall in her Palo Alto Hills home that would result in fatal head injuries. Marcus had provided detailed architectural plans of his mother's residence, along with information about her daily routines that would allow assassins to stage her murder as a tragic accident that wouldn't trigger intensive law enforcement investigation. Dr. Natasha Volkov's role in the assassination conspiracy revealed the complete absence of loyalty or moral constraints that characterized everyone involved in the trafficking network. Communications intercepted by federal agents showed her providing medical expertise to ensure that assassination attempts would be successful while creating plausible alternative explanations for the deaths that wouldn't implicate the trafficking organization. The scope of the planned violence extended beyond individual assassinations to include attacks on federal facilities and law enforcement personnel who were investigating the trafficking network. Marcus had been coordinating with international criminal associates to plan bombing attacks on FBI offices and federal courthouses that would create sufficient chaos to allow surviving network members to escape prosecution while eliminating evidence that could be used against criminal organizations worldwide. Federal security measures escalated to include round-the-clock protection for all potential assassination targets, while tactical teams prepared to prevent attacks on government facilities that could result in mass casualties. The transformation of a medical fraud investigation into a counterterrorism operation demonstrated the international scope of the criminal network that Marcus had helped create and coordinate. The planned assassination of federal prosecutor Maria Santos was intended to occur during her commute between San Francisco and Sacramento, with professional killers positioning explosive devices along her normal travel route that would create a massive traffic accident designed to kill multiple people while eliminating the prosecutor, whose expertise was essential for successful trafficking prosecutions. Intelligence gathered from Marcus's communications revealed that the assassination plots were being coordinated with criminal associates throughout Central America and Eastern Europe, who were planning similar attacks on law enforcement personnel investigating their local trafficking operations. The International Criminal Network was implementing a coordinated campaign of violence designed to destroy trafficking prosecutions worldwide while terrorizing law enforcement agencies into abandoning investigations. The discovery of weapons caches at Sterling Cardiovascular Institute and Marcus's Palo Alto Hills residence revealed that the facility had been transformed into a fortified criminal operations center, equipped with military-grade firearms, explosive devices, and communication equipment designed to coordinate violent resistance against law enforcement raids. The medical practice that had once saved lives had become a terrorist facility threatening public safety throughout Northern California. Federal agents discovered that Marcus had been recruiting additional violent criminals through his international network connections, including mercenaries with military training who specialized in conducting paramilitary operations against law enforcement targets. These recruits were being positioned throughout the Bay Area to conduct coordinated attacks that would overwhelm federal security measures while facilitating Marcus's escape to non-extradition countries. The psychological evaluation conducted by federal behavioral analysts determined that Marcus represented an extreme threat to public safety due to his willingness to use mass violence to protect his criminal interests. His medical training provided him with knowledge of biological weapons and toxic substances that could be used to conduct terrorist attacks against civilian populations, while his international connections provided access to criminal resources that could facilitate large-scale attacks. The planned violence against victim witnesses was designed to send a message to other potential witnesses throughout the trafficking network that cooperation with law enforcement would result in death for themselves and their families. This intimidation campaign represented systematic terrorism designed to protect criminal operations through fear while preventing future prosecutions of trafficking organizations. Elena Rodriguez became a particular target for assassination because her medical expertise allowed her to provide detailed testimony about Marcus's fraud techniques, while her professional reputation made her a credible witness whose testimony would be particularly damaging during federal prosecution proceedings. Communications intercepted by federal agents revealed that Marcus viewed her elimination as essential for preventing conviction on medical fraud charges. The escalation to planned violence demonstrated that Marcus's criminal network represented a genuine terrorist threat that required federal law enforcement resources normally reserved for international terrorism investigations. His willingness to murder family members, federal agents, and innocent civilians to protect his trafficking operations elevated his prosecution from organized crime to national security matters, requiring the most comprehensive law enforcement response available. The final communications intercepted before federal agents moved to prevent the assassination plots revealed that Marcus had been planning to eliminate hundreds of witnesses throughout the international trafficking network, creating a coordinated campaign of violence that would have resulted in mass casualties across multiple countries while protecting criminal organizations that had been exploiting vulnerable populations for years. The synchronized federal operation that dismantled Marcus's international trafficking network began at exactly 5:47 a.m. Pacific Time on Wednesday morning, involving over 400 law enforcement personnel executing coordinated raids across 14 states and 6 countries. Operation Sterling Scalpel. As the federal task force had designated, the mission represented the largest coordinated medical crime takedown in international law enforcement history, designed to prevent assassination attempts while simultaneously destroying criminal operations that had been threatening vulnerable populations worldwide. Federal tactical teams surrounded Sterling Cardiovascular Institute, while Marcus was conducting what he believed was a routine early morning consultation with Dr. Natasha Volkov about finalizing assassination contracts with Viktor Petrov. His overconfidence in the facility's security systems had convinced him that federal agents couldn't penetrate the surveillance networks and access controls he had installed to protect trafficking operations from law enforcement detection. The arrest occurred in Marcus's private office as he was reviewing architectural plans of federal courthouse facilities that were targeted for bombing attacks designed to eliminate prosecution evidence while creating mass casualties among law enforcement personnel. Special Agent Kane's tactical team entered through security systems that had been compromised by federal cyber warfare specialists, allowing agents to neutralize facility defenses while preventing Marcus from accessing weapons caches or destroying evidence. Dr. Marcus Sterling, you are under arrest for conspiracy to commit international human trafficking, medical fraud, money laundering, and conspiracy to commit terrorism, Agent Kane announced as federal agents secured the facility. You have the right to remain silent. Anything you say can and will be used against you in a court of law. Marcus's attempted resistance was brief and futile, as federal agents had anticipated his likely responses while planning the arrest procedures. His medical knowledge and international criminal connections had made him dangerous, but federal law enforcement training and overwhelming tactical superiority ensured that he was captured without violence while preserving evidence that would be essential for comprehensive prosecution. Dr. Natasha Volkov's simultaneous arrest at her Palo Alto apartment revealed that she had been preparing to flee the country using false identification documents provided by the trafficking network. Her luggage contained evidence of her coordination role in assassination planning, along with detailed information about trafficking operations throughout Central America that would prove valuable for international prosecution efforts. The coordinated international arrests, executed simultaneously with Marcus's capture, resulted in the detention of 67 individuals throughout the trafficking network, including corrupt government officials, medical professionals, and criminal coordinators who had been facilitating organ trafficking operations across multiple continents. The scope of the arrests demonstrated the international reach of the criminal organization while providing evidence that would support prosecutions in dozens of countries. Vincent Calabrese's arrest in Providence occurred as he was attempting to destroy evidence of his coordination role in the trafficking network. Federal agents recovered financial records showing payments exceeding $50 million to network participants over 4 years, along with detailed organizational charts that revealed the complete structure of criminal operations from victim identification through organ harvesting and international distribution. The search of Sterling Cardiovascular Institute revealed the full extent of the facility's transformation into a criminal operations center. Hidden surgical suites contained equipment specifically designed for organ harvesting, while modified storage areas were equipped with preservation systems that maintained organ viability during transportation to international transplant facilities. The legitimate medical practice had been completely subverted to serve criminal purposes. Evidence recovered during the facility search included detailed records of over 300 trafficking victims from throughout the Americas, along with financial documentation showing proceeds exceeding $75 million from organ sales conducted through the network. The scope of the criminal enterprise far exceeded initial estimates, representing one of the most profitable trafficking operations ever documented by international law enforcement. The arrest of corrupt officials throughout California's medical regulatory system revealed the extent of protection that had allowed Marcus's network to operate with impunity while systematically exploiting vulnerable patient populations. Medical board members, hospital administrators, and insurance company executives had been receiving substantial bribes in exchange for ignoring evidence of trafficking activities while facilitating criminal operations. International coordination with law enforcement agencies in Mexico, Guatemala, Romania, and Thailand resulted in the seizure of facilities that had been providing victims for trafficking operations while offering destination services for wealthy patients seeking black market organ transplants. The global scope of the criminal network had required unprecedented international cooperation to dismantle operations that had been threatening vulnerable populations across multiple continents. Financial asset seizures executed simultaneously with arrests resulted in the confiscation of over $120 million in criminal proceeds from bank accounts, real estate investments, and business ventures throughout the Americas and Europe. The comprehensive asset forfeiture would ensure that trafficking network members had no resources for continuing criminal operations while providing funds for victim compensation and support services. The arrest of professional assassins who had been contracted to eliminate witnesses revealed sophisticated plans for terrorist attacks that would have resulted in mass casualties throughout Northern California. Weapons caches discovered during raids contained military-grade explosives and biological weapons that could have been used to conduct attacks against civilian populations while facilitating network members' escape from prosecution. Margaret Sterling's protective custody during the raids ensured her safety, while allowing her to provide additional evidence about Marcus's criminal activities that federal agents had not previously documented. Her cooperation continued to be essential for understanding the full scope of trafficking operations, while ensuring that all network participants faced appropriate prosecution. The technological resources discovered during facility searches revealed sophisticated communication systems that had been facilitating coordination between trafficking operations worldwide. Federal cybercrime specialists recovered encrypted databases containing detailed information about criminal operations that would support prosecutions throughout the international network, while providing intelligence for preventing future trafficking activities. Hospital staff members who had been coerced into participating in criminal activities were offered cooperation agreements that provided protection from prosecution in exchange for testimony about trafficking operations they had witnessed. Their cooperation would be essential for demonstrating the systematic nature of criminal activities, while ensuring that healthcare institutions implemented reforms necessary for preventing future exploitation. The media coverage of Operation Sterling Scalpel created international attention that highlighted the sophisticated nature of modern trafficking operations, while demonstrating federal law enforcement's commitment to prosecuting crimes that threatened vulnerable populations worldwide. The case would become a model for international cooperation in prosecuting transnational criminal organizations that exploited legitimate institutions for criminal purposes. The coordinated takedown had successfully prevented terrorist attacks while dismantling criminal operations that had been generating tens of millions of dollars annually through exploitation of vulnerable victims. Marcus's transformation from respected cardiac surgeon to international criminal had been stopped through federal law enforcement capabilities that he had never imagined could be focused on his activities. The federal prosecution of Dr. Marcus Sterling became the most comprehensive medical crime case in American legal history, with federal prosecutors presenting evidence of 347 separate felony charges spanning international trafficking, conspiracy, terrorism, murder, conspiracy, medical fraud, and organized crime violations that collectively carried potential sentences exceeding 800 years in federal prison. The evidence assembled through our investigation would ensure that Marcus faced consequences proportionate to the enormous harm his criminal activities had caused to vulnerable populations throughout the international trafficking network. Federal District Judge Patricia Chen, no relation to me, presided over proceedings that established new precedents for prosecuting medical professionals who perverted their training to facilitate international criminal enterprises. Judge Chen's extensive experience with organized crime cases provided the legal expertise necessary for navigating complex international law issues, while ensuring that victims received appropriate consideration during sentencing procedures. Marcus's attempts to negotiate plea agreements were rejected by federal prosecutors who determined that the scope of his criminal activities warranted prosecution under terrorism statutes that carried mandatory life sentences without possibility of parole. The evidence of planned assassination campaigns and terrorist attacks against federal facilities had elevated his case beyond traditional organized crime into national security matters requiring maximum penalties available under federal law. Dr. Natasha Volkov's cooperation agreement provided federal prosecutors with detailed testimony about trafficking operations while ensuring that she faced reduced sentences in exchange for information that supported prosecutions throughout the criminal network. Her willingness to testify against Marcus demonstrated the complete absence of loyalty that characterized relationships within the trafficking organization, while providing compelling evidence of systematic criminal planning. The victim impact statements presented during sentencing proceedings created overwhelming documentation of harm that extended from preventable deaths in California to international trafficking operations that had devastated families throughout Central America and Eastern Europe. Over 400 victims or family members provided testimony about Marcus's crimes, creating a comprehensive record of suffering that justified the most severe penalties available under federal law. Carmen Gutierrez's testimony about her daughter's near assassination through trafficking operations proved particularly compelling to federal judges, who recognized that Marcus's crimes had threatened children throughout the international network. Her courage in testifying despite threats from surviving criminal associates demonstrated the importance of ensuring that trafficking operations faced comprehensive prosecution, regardless of intimidation campaigns designed to protect criminal organizations. The medical licensing proceedings conducted parallel to criminal prosecution resulted in the permanent revocation of Marcus's medical credentials, along with sanctions against dozens of other physicians who had participated in trafficking operations throughout California. The systematic corruption of medical professionals required comprehensive regulatory response that would prevent similar exploitation of healthcare institutions for criminal purposes. Financial restitution orders required Marcus to forfeit all assets acquired through criminal activities, while providing compensation for victims harmed by trafficking operations. The comprehensive asset forfeiture would generate over $150 million for victim support services, while ensuring that criminal proceeds could not be used to fund future trafficking activities or appeals procedures. Margaret Sterling's testimony during sentencing proceedings provided compelling evidence that Marcus had systematically betrayed every professional and personal relationship to facilitate criminal activities that threatened innocent people throughout the international network. Her moral courage in testifying against her son demonstrated that even family members recognized the necessity of ensuring that trafficking operations faced appropriate consequences. The international prosecution coordination resulted in simultaneous convictions throughout the trafficking network, with criminal associates in 12 countries receiving sentences that would ensure the complete dismantling of operations that had been exploiting vulnerable populations for years. The comprehensive international response demonstrated unprecedented cooperation in prosecuting transnational criminal organizations. Federal terrorism charges resulted in Marcus receiving 5 consecutive life sentences without possibility of parole, while additional charges for medical fraud, money laundering, and conspiracy carried sentences that would ensure he never regained freedom, regardless of appeals or legal challenges. The severity of his sentences reflected both the scope of his criminal activities and the ongoing threat he represented to public safety. The professional consequences extended beyond criminal prosecution to include civil litigation that would provide additional compensation for victims, while establishing legal precedents for holding medical professionals accountable for systematic exploitation of patient relationships. The civil cases would ensure that healthcare institutions implemented comprehensive reforms designed to prevent future trafficking operations. Prison assignments placed Marcus in federal maximum security facilities designed for terrorist offenders, ensuring that he had no access to resources that could facilitate continued criminal activities, while preventing him from coordinating with surviving network members who might attempt to rebuild trafficking operations. The case established new federal guidelines for investigating medical crimes involving international conspiracy, while providing law enforcement agencies with enhanced tools for detecting trafficking operations that exploited legitimate healthcare institutions. The investigative methods developed during our case would be implemented throughout federal law enforcement to prevent similar criminal enterprises. Educational initiatives resulting from the prosecution included mandatory training for medical professionals about trafficking recognition and reporting requirements, ensuring that healthcare workers could identify potential criminal activities while protecting patients from exploitation by corrupt colleagues who might attempt to rebuild trafficking networks. The federal sentencing concluded with Judge Chen's observation that Marcus's crimes represented systematic betrayal of every principle that governed medical practice, while demonstrating the necessity of ensuring that professional credentials could not be used to facilitate criminal activities that threatened vulnerable populations worldwide. His case would serve as a permanent reminder that no criminal organization was too sophisticated or well-connected to escape federal prosecution when law enforcement agencies coordinated their efforts effectively. Marcus Sterling would spend the remainder of his life in federal prison, while the international trafficking network he had helped create and coordinate was permanently dismantled through comprehensive prosecution that protected countless potential victims from exploitation by criminal organizations that had perverted medical practice into systematic human trafficking. Standing in the federal courthouse steps as Marcus Sterling was led away in shackles to begin his life sentences without possibility of parole, I reflected on the complete transformation that had occurred during the 8 months since my automated fraud detection system had first flagged irregularities at Sterling Cardiovascular Institute. The betrayed wife who had discovered her husband's medical fraud had evolved into a federal law enforcement coordinator whose investigation had dismantled one of the most sophisticated trafficking networks in modern history. My appointment as director of the Federal Medical Crimes Task Force represented recognition of the investigative expertise and moral courage that had been necessary for exposing criminal activities that threatened vulnerable populations throughout the Americas. The position would allow me to coordinate international law enforcement efforts designed to prevent medical professionals from exploiting their training and credentials to facilitate systematic human trafficking. The partnership agreement that Marcus had drafted to protect his medical practice assets had become completely irrelevant once federal prosecutors identified him as the leader of an international terrorist organization. His confidence in civil contract protections had been shattered by criminal statutes designed to strip terrorist enterprises of every resource, while ensuring that criminal leaders faced consequences proportionate to the harm they had caused. Sterling Cardiovascular Institute had been permanently closed and converted into a federal training facility where law enforcement personnel learned to recognize signs of medical trafficking while developing investigation techniques that could be applied to similar criminal enterprises worldwide. The facility that had once facilitated international trafficking would now serve to protect vulnerable populations from exploitation by criminal organizations. Margaret Sterling's courage in exposing her son's crimes had earned her recognition as a Federal Witness Protection Program success story, while demonstrating that moral principles could overcome family loyalty when criminal activities threatened innocent people. Her cooperation had been essential for dismantling trafficking operations while providing evidence that ensured comprehensive prosecution of criminal network participants. The victims of Marcus's trafficking network were receiving comprehensive support services funded through asset forfeiture proceeds while participating in advocacy programs designed to prevent future trafficking operations. Their courage in testifying against international criminal organizations had been essential for ensuring that trafficking networks faced appropriate consequences while providing support for other survivors worldwide. My personal healing had been facilitated by the knowledge that justice had been achieved not just for Marcus's betrayal of our marriage, but for his systematic exploitation of vulnerable patients who had trusted him with their lives. The investigation that began as personal revenge had evolved into systematic protection of innocent people from criminal organizations that perverted medical practice into human trafficking. The federal recognition of my investigative work had transformed my career from institutional fraud prevention into international law enforcement coordination, allowing me to apply analytical skills and moral commitment to protecting vulnerable populations worldwide from exploitation by criminal enterprises that threatened global security and human dignity. The woman who had once trusted Dr. Marcus Sterling with her heart had become the federal coordinator whose investigation ensured that he would never again threaten innocent people through systematic betrayal of every principle that governed ethical medical practice. The Anderson Protocol demonstrates how analytical expertise, moral courage, and systematic investigation can transform personal betrayal into comprehensive justice that protects vulnerable populations from sophisticated criminal enterprises that exploit legitimate institutions for systematic human trafficking.